Okay. So good afternoon, everyone. My name is Jordan Costa, and I am a fifth-year doctoral candidate in the School of Criminal Justice at Rutgers University and a doctoral researcher with the NJGVRC, where much of my research centers on structural violence, community-based solutions to reducing violence, and community trauma. Today, I'll be talking about some findings from a study that I worked on called On the Front Lines, which focuses on exploring the experiences of violence intervention workers across the country and is the first national study that samples workers serving in this role. This project was funded by and done in partnership with Gifford Center for Violence Intervention, a national advocacy group dedicated to advancing education around ways to address violence in our communities. And so this project is equal parts research as it is policy advocacy, which will be reflected in my presentation and some recommendations we came up with at the very end. So just to level set, I want to make sure that we're all on the same page when I say the words community violence intervention. The field itself is emerging and has only really been recognized under that name for the last 5 years or so. And it really only started to take off within the last 2 years when the Biden administration began discussions of an
I'm not sure if it's just me or I'm having trouble hearing you.
Oh. Let's see.
On the left side,
could you try to mute and unmute yourself?
Is it working now?
I see reception
now.
Okay, if they can hear you, then please proceed.
Can people hear me? Okay. Okay, let me pick up then real quick. So let me just rewind a little bit about our definition of community violence intervention. So as I was saying, the field is emerging over the last 5 years, and it really only started to take off within the last 2 years when the Biden administration began discussions of and historically chose to commit $250 million over 5 years to the development of programs that do this type of work. So when we define community violence intervention, we mean that we're referring to a set of non-punitive community-led strategies that are designed to interrupt the transmission of violence by engaging those at highest risk through the provision of individually tailored support services. So there are some key components of this definition that I want to bring your attention to before we go on. First, non-punitive community-led. Programs that are categorized as CVI are not responsible for enforcing the law and are led by those closest to the problem in their community because we believe that they're closest to the solution, in the words of Glenn Martin, the founder of Just Leadership USA. No one knows the ins and outs of a community's struggles like someone who lives through them every day, so we rely on those individuals, commonly known as CVI workers and practitioners, to lead us in our strategic mission. Next, interrupt the transmission of violence by engaging the highest risk. So we're adopting that public health approach by naming a specific focus on the highest risk. 63% of violence is committed by only 1% of a given area's population, and oftentimes they're not the ones being engaged the most, but we know that delivering services to them is how we get to the root. And then individually tailored support services. This is again in line with that public health approach. Think about when you go to the doctor, you don't get a miracle drug that claims to fix it all, but instead you discuss your symptoms of discomfort and your physician prescribes the medication that they think is the best fit for you to address those symptoms. Traditionally, incarceration has been used as that miracle drug to address violence, but it comes with significant side effects. Conversely, CVI programs are designed to understand those symptoms and provide treatment based on the needs of the client. So maybe that's food stamps, maybe that's housing, maybe that's a driver's license, but there's flexibility and customization embedded in there, which is the important part. Our research team was multidisciplinary in nature, made up of folks who are really skilled in research methods, former practitioners who understood the nuances of the work, policy experts that could speak to implications, and then people like myself who exist at the intersection of some of those categories. I found that my previous experience volunteering as a violence interventionist in the past and my current focus on research and policy were really useful lenses to draw from in this process because the empirical foundation for CVI is in its infancy at the moment, and what we do know is mainly focused on program impact and less about the individuals responsible for carrying out the work, which is a huge oversight. And so we believe that in order to understand the work, you must seek to understand the workers. And so when I say workers, what do I mean? I'm referring to violence intervention workers, which can have different names regionally and depending on the program. For our study, those who qualified as violence intervention workers fulfilled 3 criteria. 1, they work with those at highest risk of being shot or doing the shooting. 2, they spend at least 50% of work time physically in the community outside of the office. And 3, they provide any of the following services to that highest risk group. So case management, violence interruption, life coaching, mentoring, gang intervention, and similar services. We had 3 main questions at the core of this research. What is the work of a violence intervention worker? Number 2, what are the personal and professional challenges experienced by violence intervention workers? And 3, what are the structural barriers that facilitate challenges in the work, and how can policy address these barriers? So as it pertained to our methods, we had a sample of 200 outreach workers across 4 different cities: Chicago, Los Angeles, Oakland, and Baltimore, and the percentage breakdowns of what percent of respondents came from where are on the screen. So 39% from Chicago, 27% from LA, 19% from Oakland, and 16% from Baltimore. We chose these cities because community violence intervention work has mobilized most in these areas, so there was a promising sampling pool compared to other cities where the work wasn't fully developed enough to build a strong sample at the time. I also want to note that we separated out part-time workers, so the final subset of the sample that met our criteria for full-time employment was 180 workers, but there's a section in the report exclusively dedicated to part-time workers. Our data collection consisted of conducting focus groups with executive directors of programs to get those more high-level insights, and also disseminating a survey to outreach workers who were recruited through a snowball sampling method. So essentially having a respondent refer us to another worker to give the survey to, and then building out from there. We would meet respondents at location sites that were most comfortable for them, and they were given privacy to complete a 15-minute survey, and we were around to help answer any clarifying questions they may have had. At the end of their participation, they were given a $50 gift card as a token of appreciation for their time. So very quickly, our demographics are fairly consistent with what we know anecdotally and empirically about CVI workers: predominantly male, predominantly Black. It's not on the screen, but most are older, with an average age being around 43 years old. We see a pretty equal distribution across varying levels of education, and almost 3/4 of respondents reporting that they had been employed as a CVI worker for at least 1 to 3 years. So what did we find? I'm going to go over what we found in these different topic areas listed on the screen at a high level for the sake of time, but there's so much more great information included in the report that I hope you find time to read about. To make it easy, I put a QR code up on the screen that you can scan. It'll bring you directly to the report where you can read more. It's also likely to pop up if you Google On the Front Lines Violence Intervention too. So let's start with workforce capacity. A lot of conversations and financial investments around CVI in the recent years have been focused on capacity building, and respondents seem to be strongly aligned, especially as it pertains to outreach staff. We found that 93% of respondents indicated that there were not enough outreach workers doing violence intervention work. Older respondents in particular were significantly more likely to report that there were not enough workers in the field, and many overall indicated a high turnover, with about 43% reporting that they had seen many coworkers leave the field. Anecdotally, we know that this could be tied to things like difficulty recruiting younger workers to the field, burnout, or maybe it's about compensation. For the tremendous responsibility they carry in their community, their pay doesn't seem to reflect it, with the majority of respondents making an average of $42,000 a year. This average is not consistent with that of other public safety agencies, and neither are the benefits. Only 67% of workers indicated that their employer provided retirement benefits, only 60% reported receiving life insurance, and only 78% reported employee mental health services. And I say only because these numbers need to be 100%. With such inadequate wages, it's unsurprising and unacceptable that 82% of workers indicated that they worry occasionally about making their mortgage or rent payments, with more than a quarter saying that they worry about making these personal payments very often. And I want us to all sit with those numbers for a second, because there's so much more than statistics. That's 8 out of 10 people who have generally suffered from violence themselves and have chosen to commit their professional life to reducing its spread in the community. And they carry the added stress of not being certain that they'll be able to maintain the very basics of their own household. And I just want us to think for a second about how backwards that is. And it doesn't help that many of them also seem to worry about their employment being jeopardized because of budget cuts. In a field that historically has been dependent on many inaccessible grants and inconsistent funding, it makes sense why 85% of respondents would say that they worry sometimes to very often about losing their job. And at the same time, it's almost cruel in a way that they carry this sense of instability, given how much these workers are celebrated as pillars of CVI by those responsible for allocating these resources. When it comes to a work-life balance, it's understandably not a surprise that the majority of CVI workers have found it hard to separate their personal and professional lives. This makes a lot of sense, as many workers tend to serve the communities that they're from. And so if you're seeing a loved one, a friend, a family member in a moment of crisis that you're tasked with responding to, it's easy to see how it could be hard to compartmentalize. In fact, compartmentalizing can be so hard that 42% of workers indicated that they believe people may die if they don't show up to work, and 20% say that they worry all or most of the time about their ability to continue doing the emotionally draining work required of their role. We have to remember that CVI work is distinct and that the stakes are incredibly high. It's not about meeting deadlines or submitting paperwork all the time. In many cases, it is life and death, and so it's critical that we recognize the weight of that responsibility, especially for people who are so proximate to the issue. And as we think about proximity to the issue, we found that 93% of workers indicated that they had directly witnessed gun violence before becoming a paid CVI worker. In other words, before they had even chosen to pursue this work, their lives were disrupted by gun violence. And we see that in different ways, with over half having been a victim of gun violence themselves, having a family member who was a victim of gun violence, and or having a friend who was a victim of gun violence. And again, these are all experiences that happened prior to becoming a paid worker, where you're constantly exposed to vicariously traumatic experiences and helping people navigate periods of intense suffering when maybe you hadn't even had a chance to navigate your own. And trauma runs deep. Many outreach workers reported high levels of adverse childhood experiences, or ACEs, like we heard about this morning. These can be things like child maltreatment, household dysfunction, and other critical issues that research has shown increase the risk of violent victimization and perpetration in adulthood and the likelihood of experiencing chronic mental and physical health conditions. We calculated ACEs scores among this group and found that 94% had reported at least one ACE, with the average being 4.7 in this sample on a scale of 8. 69% of our sample reported experiencing 4 or more ACEs. And if we think about how that compares to the general population, about 36% of people have no ACEs and only 12.5% have 4 or more. Almost 70% of our sample had 4 or more, and this is consistent with other research on specific vulnerable populations, where the average ACE score was between 4.8 and 4.9. We also scored participants using the Kessler Psychological Distress Scale, which is a standardized tool used to measure non-specific psychological distress that's severe enough to cause functional limitations and to require treatment. Typically, a score of 13 or higher has been used to identify people with serious psychological distress that research has found to be associated with premature mortality and other negative health outcomes. So as you can see here, 83% of our sample had a score higher than 13, with the average being 17. So in plain terms, our workers need support. And they don't feel it from state and federal government. I will note that these numbers may be different, since 2022 was a pretty historic year in terms of CVI investments, but these numbers are only from 2021, so the sentiment still probably remains that outreach workers care about support from the government. At the time of this survey, 61% of our respondents disagreed with the notion that they feel supported by the state and federal government. And so that's why it's important to do more research and to collaborate more across sectors to remain committed to elevating the voices from the ground to ensure that we flip this graphic to reflect majority feelings of support. And part of the way we've tried to do that in this report is by providing some recommendations. So we have some identified issues. There are 6, and then we offer 6 recommendations. So the first issue is that CVI workers suffer from unequal pay and inadequate fringe benefits. We recommend a baseline pay for CVI workers to start at $45,000 a year annually, with adjustments based on cost of living and overtime compensation, in addition to medical, dental, life insurance, and retirement benefits. The next issue we've identified is that many violence intervention workers are dealing with their own untreated trauma while being regularly exposed to vicarious trauma at work. So organizations employing these workers must institutionalize trauma-informed systems of self-care and ongoing support for their employees. There's also a lack of uniform training and professional standards that hamper the field of CVI. So we recommend a national certifying entity that can implement minimum standards of training and experience for CVI workers, while also recognizing that violence looks different in different regions across the country. The next issue is that smaller violence intervention organizations may lack the capacity to leverage public grants, and we recommend the government pass federal funding to smaller community organizations through intermediaries that are specifically set up to help with this purpose. There's also currently a lack of awareness and financial support from local, state, and federal governments. And so we urge the CVI field to make a more concerted effort to raise awareness about the importance of this work. And then finally, there's currently a lack of local infrastructure to support and develop violence intervention organizations. So we recommend the establishment of offices of violence prevention to provide funding, support, and training for the violence intervention field at the local and state levels. And I want to shout out New Jersey because we've established the Division of Violence Intervention and Victims Assistance, which is led by Stephen Campos, who is a former CVI worker himself that is now at the charge of creating recommendations for the AG's office on this exact topic. And so in the spirit of scholarship and advocacy, I'll end by saying that if you want to explore ways to address gun violence, pay attention to the programs and their outcomes, but also focus on the actors responsible for producing those outcomes. This work can only be done well if the workers themselves are well too, and it's clear that they are not. We hope to replicate this study in more cities as the field develops, but before I close, I just want to take a second to thank all the partners who participated in helping with recruitment for the study across these 4 different cities. And I'm happy to answer any questions in the chat if anyone has any. Thank you. Yay for Steve Campos, yes. Yeah, so some of the key differences across sites, I will say that Chicago workers were paid the most. They also had the most staff. So right now, Chicago has about 100 CVI workers, and their average pay was $45,000 a year. That was the most obvious difference. Is there more specific differences you want me to speak to? Yeah. Yeah, I would say that in Los Angeles, the infrastructure for training and support is more robust. Baltimore is more of an emerging site, and most of their CVI programs come out of their Office for Neighborhood Safety and Engagement, whereas in Chicago and Oakland, you see them more grassroots and a more horizontal structure. But Los Angeles is certainly the most developed, especially with the establishment of their grid office in which many of these programs are connected to. I think we have 2 minutes left until the next session starts. All right, great. Well, if there's no more questions, thank you all for coming to this session, and I look forward to attending the rest of Research Day with you in the next breakout.